Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we wanted to take some time and discuss a topic that can be scary, overwhelming, confusing, emotional, and often misunderstood, and that's hospice. So today, we're going to be answering the question, what is hospice? When a family first hears the word hospice, it can conjure up many images and questions about what exactly hospice is and what it isn't. And there are also myths about hospice that families sometimes wonder about if they're true or not. Let's start by giving the official definition of hospice. The definition of hospice, according to the Merriam-Webster Dictionary, is a program designed to provide palliative care and emotional support to the terminally ill in a home or home-like setting so that the quality of life is maintained and family members may be active participants in the care. And it also notes a facility that provides such a program. One of the most frequently asked questions that we hear is, what is hospice care? And there's understandably sometimes quite a bit of confusion about what it is and what it isn't, as we mentioned previously. But first and foremost, hospice is a philosophy of the type and way care is to be delivered. When a patient goes into their doctor or even into the hospital because they have specific symptoms that are making them sick, their doctor or healthcare team is going to focus on the illness or the symptoms, whereas hospice treats the person or the individual rather than their illness or disease, and it focuses on the individual's quality of life. It goes further than that, though. It also surrounds the patient and even their family with a team of professionals who will address their physical distress, but it will also support their emotional and spiritual needs as well. The approach is centered entirely around the needs of the patient and their family, which is what drives the hospice team and their care. And it's also important to explain and acknowledge what hospice is not. And hospice is not hastening death, but rather it's about celebrating the time that the patient has left and ensuring that they're kept as comfortable as possible. We're going to be going through the most common questions that come up when discussing hospice that we feel will help in better explaining what hospice is and dispel some of the myths and misconceptions that families often have. The first question is, if my loved one is in hospice or if their doctor or medical team recommend hospice, does this mean that they're going to die soon? This answer can vary depending on their current condition and health. But hospice is for people who have a limited life expectancy and is for patients that a doctor would not be surprised if they were to pass away within the next 6 months or so. However, that does not mean that the patient is going to pass within 6 months or sooner. It simply means that their condition makes them passing a very real possibility given their current state. And we've seen people have complete turnarounds and get discharged from their hospice providers. There's also a service called palliative care that offers many of the same and similar services as hospice, but is geared towards patients who may not necessarily pass within that 6-month period. We'll be discussing palliative care in a future episode at All Home Care Matters, but for now, think of them as being related in the sense that palliative care is becoming more widely used now before patients are admitted under hospice care when it's appropriate. So if your loved one is admitted into hospice care, and again, it also depends on a case-by-case basis for each patient, it does not mean that they are guaranteed or expected to pass right away. It does mean that their doctor has an expectation that their condition may cause their death within a 6-month window, as that is part of the criteria for being admitted into hospice. The next question that we often hear is, who is best suited for hospice? Hospice patients are those who have very serious medical conditions that are typically life-threatening. Their condition makes their day-to-day living very uncomfortable physically, emotionally, and spiritually that can also be accompanied by acute pain. And they can also experience nausea, difficulty breathing, shortness of breath, extreme fatigue, and other difficult symptoms that can be caused by the disease or the treatments that they receive to cure the disease. And it's usually because of these symptoms and conditions that patients and their families turn to hospice. Hospice specializes in treating the individual and their families who are going through these difficulties and provide them comfort and support for their spiritual needs, their emotional needs, and their pain control and management needs. And the patients who are typically the most seriously ill, that want to have the best quality of life possible, are the ones best suited for hospice care. If we use hospice, does this mean that we are giving up? Absolutely not. This is actually one of the most common questions that come up about hospice, and it's a big misconception. Even though your loved one's condition may have reached a point that a cure seems unlikely or even impossible, or maybe they've reached a point that the side effects of their treatment is unbearable, that does not mean there's nothing left to do. In fact, the emphasis on the quality of life and easing pain can allow for your loved one to spend their last months to focus on the things in their life that are the most important and the most meaningful. Some families and patients ask this question, that if they are in hospice, are they able to leave hospice? Yes, the patient and their family can choose for any number of reasons to sign out of the hospice program at any time they decide. For example, they may choose that they want to resume treatment measures for their illness, such as chemo or radiation, or maybe they've learned of a new potentially promising experimental treatment and they want to try it. Another reason that they may choose to leave hospice is that their condition has improved and there are encouraging signs for their recovery and their prognosis, so that they no longer meet that 6-month guideline. Now, this also doesn't mean that they cannot be readmitted back under hospice care if their condition does not improve or if they decide not to continue with the treatment. Another question we hear often is hospice something that we should wait for our doctor to recommend? If you feel more comfortable waiting for your doctor or healthcare team to recommend it, then yes. However, your doctor or healthcare team may wait too long to recommend it or for the family to bring the discussion of hospice up. This is one of the primary reasons that families receive hospice care so late in the process. If you, your family, or your loved one feel that hospice could be beneficial to the care, then talk to your doctor and healthcare team as soon as you feel it's time to discuss it. This isn't to take away anything from the doctors or the healthcare teams or professionals, but they have many patients and families that they're responsible for, and you only have yourself and your loved ones to care for. And if you're being honest with yourself and you believe that your loved one could pass within the next 6 to 12 months, ask them if they agree. If they agree, then this is the right time to discuss hospice, and if they feel that it isn't necessary right now, they can discuss other options that may be more beneficial and appropriate at this time. We cannot say this enough. Don't be shy with your doctor and healthcare team. Anytime you have questions, concerns, or even if you need something better explained, you're going to be your best advocate. And healthcare professionals are generally more than happy to answer your questions and explain things better to you so you understand them. Now, finances are always something in the back of everyone's mind. So we hear this question very frequently. Do we have to pay for hospice care? And as I said, one of the first questions families ask when it comes to hospice is, who pays for it? And this is typically also one of the first things families want to know about when discussing hospice and what the financial options are. This is understandable, and worrying about paying for hospice care is very common. The good news is that the worries families have about how to pay for hospice is generally unfounded. The patient and family usually have several options when it comes to funding hospice care. If the patient is a Medicare recipient and meet the hospice requirements, then the government pays as much as the total 100% cost of the care, and there would be no deductible and no copays. And this means that not only are the hospice staff entirely paid for, but the medical supplies and the medications relating to pain, comfort, and management are also covered as well. But if the patient does not have Medicare, but they have private health insurance coverage, they should speak with their respective insurance carriers to find out about their eligibility and what, if any, deductibles and copays that may apply. But if the patient does not have Medicare or private health insurance and has Medicaid, they would need to find out what their specific state's coverages allow for as it relates to hospice. Every state's coverage for Medicaid recipients can vary from state to state. Another question we hear frequently is, Will hospice only provide care for patients that are housebound and bedridden? Hospice provides care wherever the patient lives, whether it's in their home, hospital, a long-term care facility, assisted living, or retirement communities. They will provide care regardless of where the patient lives. Hospice is a wonderful resource for families and their loved ones. We have worked side by side with many hospice providers and hospice volunteers, and the support and resources they offer families are so beneficial for families during some of their most difficult times. We need to also mention one of the misconceptions that sometimes a family may have when they start hospice care, and that is, will they be with their loved one whenever the family needs them? No. We felt it was important to mention this because many times families feel that once they start hospice, that the hospice comes in and will stay with their family, and then the family can no longer have to miss work or no longer have to stay at the home. But hospice will not come by and stay, say if you need them 8 hours a day or 12 hours a day. They're not caregivers and they're not home care providers. Many times, hospice works side by side with families and with home care providers, but they won't be there for shift work or day-to-day work. Though sometimes hospice offers what is called respite care, where if a family needed to, they could place their loved one into a respite facility that is designated by the hospice provider for a designated and agreed upon number of days temporarily if they need respite for themselves. And this would be something that you would need to discuss with the hospice provider when selecting who the hospice provider is to be. We appreciate you taking time to visit us here at All Home Care Matters, and we want to thank you. All Home Care Matters is here for you and to help families as they navigate long-term care issues. Please visit us at allhomecarematters.com, where there is a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. If you know somebody who could benefit from this episode, please share it with them. And we hope you will join us next time on All Home Care Matters, where we're going to discuss what palliative care is. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.